Okay, today we're going to have a teach back on very important chapters in our textbook on pathophysiology. Let's start first with blood flow, right? Why? Because obviously it's important that when we work as nurses and doctors, we deal with patients having problems with blood flow, right? Okay? And of course, when you say blood flow, it involves what? Blood vessels, right? So if you remember the anatomy of the blood vessel has 3 layers in them, right?
Yes.
The first layer is the outer layer. If this were a blood vessel, the outer layer is called tunica what? Adventitia, right? And what's the second layer? Media. Media for M for middle layer, right? And what is the middle layer? The innermost layer. Okay. In other words, what surrounds the lumen is called tunica intima. Does anybody know what tunica means? What does tunica mean? What? Of course, layer. Very good. Tunica means layer. Intima is the innermost layer. And what is found in this layer of intima? What do you find there? Yes? Very good. It's called the endothelium, right? And it is very thin, made of squamous flat cells. And normally when you're young, you don't expect to have fat deposits there, right? Right? Now, what is the second layer? The middle layer? It's made up of what? Smooth muscles. And if you remember, muscles can either what? Contract or relax. Now you might be wondering, do I need to really go back to my anatomy and physiology? Definitely, right? Right? Okay? When muscles contract in the wall here, so this is an example of an artery and a vein, right? Which one is the artery? The red one because it carries oxygenated blood. What about the blue one? The veins. Are these blood vessels? Now these 2 blood vessels have exactly the same what? Layers, right? Now, apparently, when the muscles contract, it leads to what? Vaso what? Very good. And what happens to the blood flow if you vasoconstrict? The blood flow or the amount of blood flow will be what? Decreased. Right? But what will be the effect on blood pressure if you vasoconstrict? It will go up. Increased blood pressure, right? And we'll explain later on with some formula. What is the opposite of contract? Relax. Now remember, when we talk about muscles, they can either contract or relax. They do not dilate. They do not constrict. What will constrict would be the blood vessel. But what happens to muscles? They can either what? Contract or relax. You learned that from anatomy, right? When these muscles relax, what happens? It leads to vaso what? Dilation. And apparently, everything will be the opposite, which is what? What happens to the blood flow? When you dilate, you make this bigger, the lumen becomes bigger, and therefore the amount of blood flow will be increased. But what will be the effect on blood pressure? A drop in your blood pressure. So remember these things. Apparently, what we need to make you understand is that the reason why we need to know this is because when we give certain medications, for example, in patients with heart disease because of fat deposit in the heart here, okay? Remember the word coronary artery? This is your heart. This is the aorta here. And the coronary artery, there are 2, right and left. And I mentioned this last week. The moment you have fat deposits on the wall of an artery, like this one here, what happens to the lumen? Gets smaller. What happens to the blood flow? Decreased blood flow, right? And when there is decreased blood flow in this area here, because of the presence of fat deposit, what happens? You have what? Ischemia. Remember the word ischemia? Decreased blood flow. Will that lead to chest pain? Yes, it can. And I don't know if I mentioned the name of the drug that we give. You place it under the tongue. It's called what? Nitroglycerin. The doctor will tell the nurse, give the patient nitroglycerin under the tongue. What will this drug do? Make the muscles what? Contract or relax? Where? In the wall of the coronary arteries of the heart. It leads to vasodilation. Will that increase the blood flow? Remember, in this case, there is ischemia, decreased blood flow because of the presence of fat deposits in the wall or tunica intima of the coronary arteries of the heart. By causing the vasodilation of these coronary arteries, will that increase the blood flow? It will. Will that help relieve the chest pain? Yes. What is chest pain again? So what kind of medication is nitroglycerin? Is this anti-anginal medication? You know what anti means? Against chest pain or angina. The idea, therefore, there is nothing that you cannot answer in your nursing board exam. From pathology to pathophysiology, if you know what is normal, then you know what's abnormal, you know what is going to be the pharmacology of this disease process. Now, my question to you is this. If you give nitroglycerin to these patients, what do you think should I tell the nurse to watch out for a possible complication when you give this drug? Yes. What happens to the blood pressure? Why will it go down? As you can clearly see. Expect blood pressure to drop as a result of the giving of nitroglycerin. Because remember, this drug will not only affect the coronary arteries of the heart, but can also affect what? All the other arteries of the body. Do you understand? In other words, what I'm trying to show and make you realize is that before you give the drug, you must document the baseline what? Blood pressure, pulse, heart rate, respiration, and all these things, right? The vital signs. For example, you gave the drug at 6 in the morning because the patient complained of angina, and Dr. Gamo said, give isosorbide dinitrate or nitroglycerin, 5 milligrams sublingual, PRN. What is PRN? As needed. Okay. So you put in the chart. At this time, at 6, I gave 5 milligrams under the tongue sublingually. And at 6 in the morning, because of chest pain, graded from 0 to 10, it was around 7 or 8. It's a way it's called pain scale, you know. 10 being the most painful experience they ever had. And then when you gave the drug, the blood pressure was 130/80. Heart rate of 85. After 30 minutes or 15 minutes, you get the blood pressure again. From 130, it went down to 100. Is that a drop of a blood pressure systolically? Yes, it is. So you call me and say, Dr. Gamo, I gave nitroglycerin at 6 in the morning. The pain was relieved, but there was a drop in the blood pressure systolic from 130 to 100. So what do you think will I tell the nurse to do? Yes?
Lower the dosage.
Lower the... You could be a doctor then, huh? I will tell the nurse, I will lower the dose from 5 milligrams to maybe 2.5 milligrams, right? Now, if it's still going to persistently go down, then I may have to give another drug. Does that make sense? Okay? So that's important that you and doctors work together. We cannot afford to have a nurse who is not smart and competent. There's a nurse must know the pharmacological basis of giving the drug called nitroglycerin. We cannot afford not to know, because this is going to be 15% of the questions in the nursing board exam. It has to do with pharmacology and the possible complications of a drug. Do you understand? Okay. Now, this is something very, very important. You give the medication under the tongue. How was it able to go to the heart? Yes?
Capillaries in your tongue.
In the tongue? What about the capillaries in the tongue?
The medication.
Okay. So if you were to trace, following a GPS, gamma positioning system, now I'm just joking, how would you trace the flow of the drug from the tongue all the way to the heart? You need to know that. Huh?
Bloodstream.
Okay, precisely. So your answers and your answer are related. Blood vessel, capillaries under the tongue. It travels through the blood circulation. If you remember the anatomy of the heart, the right atrium, the right ventricle, left atrium, left ventricle. What brings blood to the right atrium? Superior what?
Superior.
And inferior vena cava. The superior vena cava gets all the blood, the veins, from the head, the neck, and the upper limb. Okay, so the tongue, is that part of the head?
Yes.
There you go. So the tongue is part of the head. There are capillaries there. The medication, which is a chemical product, goes by diffusion into the capillaries of the tongue, and these capillaries will go into the veins of the tongue, then the veins of the neck, which is called the jugular veins. Jugular veins goes into what? Eventually into the superior vena cava, then right side of the heart, then to the lung, left side of the heart, then to the left atrium, left ventricle, and then what happens? The medicine will what? From the left ventricle to the aorta, but it goes down to the what? Aorta to the coronary arteries. Do you understand? What about if you give it in the form of a medication skin patch? Can we give this drug in the skin patch, on the form of a skin patch in the chest?
Sure.
Of course. Why? Why would I give it in the skin patch here? Yes? Does anybody know?
It could be absorbed.
Is it possible for the medication to what?
Be absorbed through the pores?
Through the pores. Okay. Now remember, my dear student, what comes out from the skin pores? Sweat. So do you expect the medication to go to the sweat glands?
No.
What is found in the sweat gland? Sweat. What is it that we want the medicine to travel through?
Bloodstream.
So what do you think is found in the skin?
Vessels.
Miss, my dear? Miss Padre? Sheila?
Vessels.
I know, which vessels? Vessels. The one you said.
Capillaries.
Of course. Do we have capillaries everywhere?
Yeah.
Because every single cell and tissue of the body has to have a capillary in order to provide oxygen and carbon dioxide removal. So skin, brain, muscle, bone, every part of your body has a capillary, which is the smallest blood vessel in the body. Are there capillaries in the skin in front of the chest? So the same thing. So, therefore, if you put the medication patch here, this time, anything below the heart, inferior vena cava. Anything above the heart, superior vena cava. Does that make sense? The same thing, if you put the patch here, it goes to the veins here, vena cava, right atrium, right ventricle, goes to the lung, but it's not needed in the lung, it goes to what? Back to the left atrium, left ventricle, then aorta, then eventually into the coronary arteries. What about if I decide to give the drug in the form of oral isodil or isosorbide dinitrate? Can it be absorbed in the blood circulation?
Yes.
Of course. Why? If you remember, this is the esophagus, the mouth is here, okay? Stomach, and then the small intestine here. What do you find in the wall of the small intestine? The villi, and again, the capillaries. And therefore, if you take a drug in the form of oral medications, it will travel through the small intestine where it will be absorbed. And we say absorb, it goes through the blood circulation. And again, the same thing. You have the mesenteric veins, and eventually it ends up in the inferior vena cava, because all the blood vessels below the heart will be drained by the inferior vena cava, and eventually ends up the same pathway, the right side of the heart, right atrium, right ventricle, pulmonary artery to the lungs, then back to the left atrium, left ventricle, then aorta, In other words, the final destination has to be what? The coronary arteries. Okay? Yes?
So the drug doesn't get absorbed at all until it reaches the small intestine, is what you're saying?
In the case of oral medications.
Okay.
Oral means stomach, then small intestine. But as I said, there are medications like sublingually given under the tongue, because this is the dilemma we have as doctors of medicine. We expect the nurses to know these things because they are supposed to be what? Smart, competent, critical thinking. But the moment we ask them these questions, they cannot answer them. Because what happens to their anatomy background?
Terrible.
They forget. In other words, there is going to be a scientific basis for everything we do with our patients. And we expect you to do the same thing. Expect to be able to justify why was it given under the tongue? Why was it given in the chest plate, in the skin? Why was it given orally? So which do you think is faster? Through the tongue or to the stomach or oral? It will be probably most faster by sublingual given. What about IV? Fastest. You bypass the tongue, you bypass the stomach and small intestine if it's given intravenously. Do you understand, class? Right? Does it make sense? Okay. Now, going back to this, therefore, as you can see, therefore, whether it's an artery or a vein, both of them have the same layers: tunica intima, tunica media, and tunica adventitia. Right? The only difference is that the veins, the lumen are usually bigger and wider, and the walls here are much thinner. Okay, the veins are the ones that are in blue. As we said, carries deoxygenated blood or blood rich in carbon dioxide. While on the other hand, the arteries are the ones that carries what? Oxygenated blood. Now, who is going to transport the oxygen and the carbon dioxide? Which cell? What? The red blood cell. What is another name for your red blood cell? Erythrocyte. Erythro red cyte means cell. Okay? Now, let me ask you this. Review of the anatomy and physiology of the arteries and the veins. What is a unique feature that is found in the veins only that is not found in the arteries?
Valve.
Very good. And what is the purpose of the valve in the veins? What is your name?
Scott.
Scott?
Yes.
Why do you have valves in the veins? Scott?
It allows for a one-way travel up back.
One-way travel, in other words, unidirectional flow. Travel towards where, Scott?
To the heart.
Of course, passing to what? To the vena cava.
Yeah.
And eventually into the right atrium of the heart. Superior vena cava from the head, neck, and upper limbs, lower limbs, and this area here, abdominal pelvic area, inferior vena cava. So that's one thing. To allow the blood to flow in one, isn't that a band? One direction. Adam Malik or something got out and they got disbanded. One direction. And most importantly, number two, it prevents what? Prevents what? Prevents what? Hi, my name is Prevent Backflow. What is your name? Valves. Hi, my name is Valves. What is your name? That is one way of learning and retaining information by clunking. What is clunk? To group together that words that are related, cousins, brothers, and sisters. So when I say valve, veins, prevent, backflow, allow one direction. Do you understand? So if we were four holding hands, veins, blood flow, one direction. The other name is what? Prevent backflow, right? Does that make sense? So if I ask you a question, therefore, in the quiz, what is the function of the valve? Two things. Allow the blood flow in one direction and prevent backflow. And therefore, based on that knowledge, in the leg veins, we call them saphenous vein, S-A-P-H-E-N-O-U-S, the great and the lesser saphenous veins of the legs and the thigh. What happens if the valves are not working properly? And the valves are mal in Spanish means bad, right? Malfunctioning. What would be the result of a malfunctioning venous valves? Yes. DVT, unfortunately, is not the answer. At least you tried. Yes.
Thrombosis.
Unfortunately, it's not the answer. Yes.
Varicose vein.
Smile an everlasting smile if the answer is correct again. I'm not saying that your answers are wrong, but the best answer always would be varicose veins. And we're going to talk about thrombophlebitis and deep vein thrombosis, right? DVT, right? So we'll talk about that later on. Okay, now, the bottom line, therefore, is that knowing what is normal, valves, and what happens when the valves are not working, varicose veins will happen. Okay? Valves are present only in the veins, not in the arteries. Is that clear? Okay, now, so how important is knowing the chambers of the heart and the blood flow to the heart and away to the heart? Very important. Because if you do not know the blood flow to the heart and away from the heart, you will be LOST. What exactly is LOST? Lost. And during the quizzes and you take the nursing board exam, you will also be what? LOST. And what are the chances that the student or graduate of West Coast will guess?
0.
100% if you do not study, right? And guess what? You can afford to be guessing. It's a matter of your future, right? You want to be sure of your answers, right? Okay. Now, there are certain formulas that are important for blood flow. What is Q is equal to P over R? What does Q stand for? Okay, what about P? Pressure gradient, right? Or delta P or pressure gradient of the blood. Okay? Bearing in mind that in order for the blood to flow, for example, if this is the heart, this is the left ventricle, this is the aorta, the pressure is highest where? In the aorta. Why? Because that is where the blood came from the pump. What is the main pump of the heart? Which chamber? The left ventricle. It's called systole. Contract and then relax, diastole. When they contract, it generates a tremendous amount of pressure. The blood will flow from high pressure to low. From high pressure to low. High pressure to low, right? It pierces the diaphragm, ascending arch, descending aorta. Then in the thoracic cavity, what is the name of the aorta in the thoracic cavity? What is the name of the aorta in the thoracic cavity? Huh? Keep it simple, student. I already gave you the answer. Thoracic aorta. Don't you love anatomy? The moment it pierces the diaphragm, it enters the abdominal cavity. What is the name of the aorta in the abdominal cavity? Oh my goodness. When we say cadavers at UCLA, I say, what is the name of the aorta in the abdominal cavity? And they all look at each other. This is a trick question, Dr. Gamon. It's called KISS. What is KISS? Keep it simple, smart student. Very simple. Why? Because the word complicated is only used where? In Facebook. Remember in Facebook, relationships complicated. Here in this class, we simplify things. And that is my role. My role is to simplify things that you will understand and most likely what? Remember and will not forget, right? Okay. So, the abdominal aorta divides in the pelvic region into the common iliac, and then external iliac, internal iliac, external iliac becomes femoral artery, and becomes femoral, becomes tibial, and peroneal, fibular. Okay, now, the idea therefore is, by knowing this, blood flow will only flow from high pressure to low pressure, and then, Now, what connects the artery with the veins? What do you call a small artery? What do you call a small vein? And what connects the two? Okay, what is found between the two? And these are all found everywhere. Every single part of your body has a capillary. Brain capillaries, muscle, bone, everywhere, right? And you have cells here, right? Cells here, cells. So when the blood is coming from the arterial side, the red blood cell is carrying what? Oxygen. Oxygen will diffuse from high to low, from high to low. Now what will the cell produce as a waste product? Carbon dioxide, CO2 will come from high. So now the red blood cell has a new passenger. It's like a red bus. Who becomes a new passenger? CO2 goes into the veins, right? In other words, for this to occur from right to left, which one has higher pressure, the artery or the veins?
Artery.
Artery, capillary, then veins. So it will have to flow from high pressure to low pressure. Does that make sense? Okay? It's called pressure gradient or delta P. Now, what is R, my dear students? And what is the definition of resistance? Huh? How would, yes?
Opposing forces.
Perfect. So if this is the blood is flowing this way, if you have a fat deposit, will that oppose the flow of blood? What about if you vasoconstrict, decreasing the radius? Will that oppose the flow of blood? Will it resist the flow of blood? Oppose is the key word to remember. Right? Okay? So resistance, pressure, and flow. Is this a formula that you must not forget? Now, the problem with us many times is that the same thing with me. When I was a student, I just simply memorized things. Now I learned more than that. I said, I need not just memorize things, but I need to understand what is the significance of this formula to me as a doctor and to you as a nurse. Very simple. I need to be able to determine the relationship between all these factors right here. What is the relationship between pressure gradient and blood flow? Inverse or direct? Direct relationship means if you increase the pressure gradient, what happens to the blood flow? If you decrease the pressure gradient, what happens to the blood flow? Remember that. A direct relationship. What about resistance and blood flow? Inverse, which means if you increase the resistance, what happens to the blood flow?
Decreases.
On the other hand, if you decrease the resistance, what happens to the blood flow?
Increases.
There you go. Now, let's go now to the next formula that I expect you to memorize and know. It's called the Poiseuille's law. Poiseuille's law. Can anybody tell me what exactly is this law? The name, give me the detailed formula of the Poiseuille's law. Because it's very important for this chapter on blood flow. Yes, my dear?
Cardiac output.
What?
Heart rate times systole. Stroke volume. Heart rate times stroke volume equals cardiac.
I think that is what is not. Are you talking about cardiac output, heart rate, and stroke volume? Is this not what I'm looking for?
There is not. Okay.
Yes, at least you tried. I like that. Do not hesitate to answer. Even if your answer is wrong, try your best. Just give me whatever you think. I will not try to publicly humiliate you by saying, oh, it's wrong, blah, blah. No. Try your best. Yes, you are trying to raise your hand.
Is it resistance equals 8 NL divided by pi r to the 4th?
Am I smiling at you? But the only reason my smile is not complete smile because you were not sure. You have to be sure! What's your name?
Maria.
The reason why I'm shouting to keep me awake because I only had 4 hours of sleep last night, so I'm not shouting because I'm angry. I'm just shouting to keep you alive, staying alive, staying alive. Okay, according to Maria, Maria said it is what? Resistance. Let me erase this. Okay. R for resistance here is equal to 8NL over pi r to the 4th, whereby R is radius, L is the length of the blood vessel, and what about N? Viscosity of the blood. A formula is going to be useless unless you know how to apply the formula in clinical resistance. Okay. Let's start first the relationships. Resistance, compare, what is N? Viscosity of the blood. What is the relation? Direct or inverse? In other words, increasing the viscosity, what happens to the resistance? Increase resistance. If you increase resistance, what happens to the blood flow? It goes down. Do you understand? On the other hand, if you decrease viscosity, what happens? Decrease resistance. Decrease resistance, what happens to the blood flow? It goes up. You see how important that is? Now, it's not just a matter of knowing what is resistance and the effect because of its direct relationship. Can you give a concrete example upon which the viscosity of the blood becomes increased? What clinical condition can increase viscosity of the blood? Huh? What? I like this guy. This is so smart. I'm having an intellectual seizure. I do the same thing in the cadaver room. Your answers are good, correct. Okay, explain to your classmate, my dear, what is polycythemia? Of course. Imagine your red blood cell count goes up. In other words, there's so many what? Red blood cell, in other words, becomes concentrated in polycythemia. P-O-L-Y-C-Y-T-H-E-M-I-A. That will increase the viscosity. It becomes more concentrated. It creates more drag on the wall here. Does it make sense? Okay? Do you understand? Now, the length, of course, I do not have to explain. Or the length of the blood vessels, the longer it travels, the more resistance, because there will be what? Friction forces on the wall, right? And therefore, increased length, increased resistance, and increased resistance means what? Decreased blood flow. Does that make sense? Okay? Because these are all direct. Increased length, increased resistance, inverse, decreased blood flow. Do you understand? Am I too fast or am I too fast? If I am fast, tell me, especially the people at the back. Can you see my illustration here? To be honest, I always tell people at the back to come to the front. I took a bath today, so I don't really smell. And we didn't have any cadaver dissection today, so I'm just joking, okay? So, what about radius? What is radius? Radius is defined as what? What is the distance from here to here? Diameter. What is half of radius? Half of diameter. Sometimes my brain is faster than my mouth. My mouth is so slow, okay? Diameter from one end to the other end, and then half of that would be radius. The idea, therefore, is this. When you increase the radius, can you imagine r to the fourth exponential power? Increase the radius, what happens to the resistance? Inverse. Opposite. Increase radius, decrease resistance, what happens to the blood flow? That is reason why it explains what happens in vasodilation. When you vasodilate, what happens to the radius? Of course, you dilate, the radius becomes higher. The moment you increase the radius, what happens to the resistance? It decreases. And the moment you decrease the resistance, what happens to the blood flow? It increases the blood flow. That's the reason why we give nitroglycerin. If you can explain in that scientific way, I am pretty sure you will pass the nursing board exam with your eyes closed. After you read the question, of course, and after you have you answered. But it takes a lot of hard work, a lot of knowledge acquisition, and what? Comprehension. And most importantly, what? Retention. Because if you cannot even memorize this formula and this formula, you are going to be in deep stool. Not shit. Okay. Oh, stool, excuse me. Stool. S-H-I-T and stool mean the same thing, right? Feces, excreta, poo-poo. Did you make poo-poo already? Okay. Does that make sense to you guys? Okay. So, the presence of fat deposit on the wall of a blood vessel, particularly an artery, is called what? Atherosclerosis. Does anybody know what is sclerosis? Huh? What? Well, that is the deposit of fat. It's called plaque. Plaque is the fat deposit on the wall. P-L-A-Q-U-E. P-L-A-Q-U-E is plaque. It's a plaque of recognition because you will die soon. I'm just joking. Look at me. What do you find here inside my abdominal cavity wall? Used to be a 6-pack of muscle. It's now 1 pack of fat. No, I'm just joking. I never had any 6-pack. I don't even know what it feels like, but that's my dream. I have a dream. For 10 years now, I see these models on, you know. But instead of having a 6-pack, it became 1 pack of fat. Am I at risk of developing heart disease? Yes. Will I develop atherosclerosis of my coronary arteries?
Yes.
I have a sedentary lifestyle. I do not exercise. I used to be a basketball player, a varsity player in med school. I would run from one end of the court to the other end. I used to climb the stairs, but I always use the elevator because I'm a lazy man. With a sedentary lifestyle, I love to go to Panda Express and eat a lot of food. Will I develop atherosclerosis in my coronary artery disease? Is that coronary artery disease or ischemic heart disease? Why is it called ischemic heart disease? Because there is what? Fat deposit in the wall due to atherosclerosis. That's why it's called coronary artery disease, otherwise known as ischemic heart disease, otherwise known as atherosclerotic heart disease. Thank God I have no chest pain yet. Not yet. Okay, soon to come to this theater. Okay, now the bottom line therefore is when you have fat deposit there, what happens to the ranges? Goes down. What happens to the resistance of flow? Increase. And if you increase resistance, what happens to the blood flow here? But hopefully I will not develop what? Angina. In other words, what I'm trying to tell you is that it's still not there. But soon it will come. I can just predict in the next 1 or 2 years it will be there. Okay? Do you understand? Now, so what we're trying therefore to show to you is that this formula is so important because this is the formula that will explain the signs and symptoms of your patient. This is the formula that will tell you what is the reason why we give nitroglycerin. It is a vasodilator which will dilate, increasing the ranges. And if you increase the ratio, if you increase the resistance, decreased resistance means what? Increased blood flow. That's the reason why there is relief of the angina or chest pain among our patients. But of course we have to monitor what? A drop in the blood pressure. Because we may have to what? Titrate or lower the dose of the medication. Does that make sense? Now, so we have discussed about atherosclerosis, and this is something very important, right? Because in terms of atherosclerosis, can you form a clot in the arteries? Yes, yes. In other words, if you form a clot in the arteries, or particularly the chambers of the heart, can it travel?
Yes.
Yes, so that's why we said, if you have a clot here in the left ventricle, can that clot travel to the aorta?
Yes.
Can it go to the brain?
Oh, yes.
Of course, common what? The common carotid eventually ends up in the brain, right? The cerebral arteries, right? You understand? So whatever is formed inside the wall or an artery can end up with a clot, right? Now, what about in the veins? Somebody mentioned a while ago about thrombophlebitis and deep vein thrombosis. These are all involved, what? Arteries or veins? Don't you love it? What does phlebo mean? Vein. Phlebotomy, what does phlebotomy mean? Creating an opening or hole so that you can drain the blood. You are a phlebotomist. What do you use to drain the blood of a patient? A needle and a syringe. the word phlebotomy, therefore, is the creation of an opening or hole with the use of a syringe and extract the blood of the patient. Now, the word thrombophlebitis, DVT, thrombophlebitis, what does thrombus mean, my dear? Huh? A clot. And where is the clot found?
And the superficial venous, or does it matter?
It was what? If the clot is found where? In the vein. That's why it's called phlebi. Thrombophlebite. What is itis? Inflammation. What are the cardinal signs of inflammation? Rubor, redness, dolor, symptom, pain, calor, palpation, warm, and tumor, increase in size, swollen, right? So if a patient comes to you and say, nurse, I am a 70-year-old male patient, and what's your name? Gina. Nurse Gina, I have pain in my right leg. What would you do, Nurse Gina? A 70-year-old male patient who happens to be me. I'm now retired, and I am your patient in the home care facility, and I tell you I have pain in my right leg. What would you do? What is the first thing that a nurse must do?
We'll check for signs.
Huh?
If it's red, or if it's
So what are you going to do? So she's good, she's smart. I'm going to hire this woman, huh? So before you tell the doctor anything, you will do your own initial what? Physical examination. Okay? So how would you go about the physical exam, Gina, on my booty?
Here, I'm going to look at the leg.
How can you be able to look at the leg?
Pull your pants up.
Huh?
What do you mean, how am I going to look at your leg?
Are you going to look at the leg like this?
No, pull your pants up.
Okay.
That's me exposed.
So you're going to pull my pants up, like whatever I wear in the nursing home?
Where is the site that you're complaining about?
So I said right leg. So what would you do?
Right leg. We're going to look at your right leg.
By pulling up the pants like this, right? And you see my leg, right? Are you going to pull the leg on the left side? Yes or no?
Yes. Am I going to look at, sorry?
On the left leg.
What am I going to do with the left side?
Are you going to pull the pants through? Yes or no?
Yeah, so you compare it.
Okay. Because you listen to their answers, right? Okay. I'm just kidding. Your first answer. Okay. I'm just joking. So make sure you know the answer correct, right? So you always want to open the left leg and open the right leg so you can compare. Even though the comparison, the patient said right leg, but you have to compare with the left leg, right?
Yeah.
So you should look for what? Redness, calor, dolor, and all the signs of inflammation.
Right.
Because phlebitis means it's inflamed. Which is inflamed? The veins.
Right.
The only thing is that not only is the vein inflamed, but there is what? What does thrombo mean? What kind of clot is a thrombus? Huh? Stationary clot. In other words, for it to be stationary, it is attached where? To the tunica intima of the veins. It is attached to the wall. Now, the question is, this development of thrombophlebitis among patients is very common. What is a predisposing factor to the development of thrombophlebitis in these patients? Yes, the gentle lady at the back in the corner. Yes, my dear? Very good. Immobilization. You're the LVN, right? Immobilization. So how can you prevent the development of thrombophlebitis among our patients? Mobilized by what? How? Walking. Very good. What about dancing? Walking, dancing, and range of motion exercises, right? That can prevent. Because if you do not exercise and move the leg, the chances of developing thrombophlebitis is very high. My question now is this: primary prevention. The problem now is, what if you already have thrombophlebitis in that leg, and there is redness, dolor, calor, tumor? You were able to confirm that there is the presence of a 10 by 10 centimeter redness in the posterior cuff area, which is the most common area. Why here at the back? Why not in front? Why is it that the redness and the pathology is always at the back of the leg in the cuff area? Does anybody know? Yes? Are you saying something? Yes? Does anybody know? It's very simple. Where do you think are the veins found? In front or at the back? Don't you love anatomy? Tararararang. What do you have here? The tibia. How can there be a vein in the bone? What is at the back? Gastrocnemius and soleus muscles. And what is embedded in these muscles? The vein called the saphenous vein, leg veins. Does it make sense? Again, it always goes back to what? Anatomy and physiology. So the big question therefore is, you put that in the chart, initial physical assessment, nursing assessment, presence of a 10 by 10 centimeter redness. We call that erythema. Erythema means red. It is warm on palpation. Palpate means to touch. You don't say touch. You put the word palpate. The kind of words that you use will determine the level of intelligence the student has. I look at the way you answer questions by oral answer and verbal and written. I know how intelligent you are. You don't say touch, you say what? Palpation. There is pain. It's called tenderness on palpation. Tender means pain on touch, right? Now, are we going to exercise this leg, my dear? You're a nurse. Yes. Once you have diagnosed her to have thrombophlebitis, are you going to exercise?
No.
So the first answer was yes. Now the answer is no. So which one is which? I am confused.
No.
Okay, is that your final answer?
Yes.
Okay, why no?
Because the clot could break off.
And then?
Travel
Travel where?
to the
Shh, quiet.
to the lung.
Hmm?
To the lungs.
To the lungs. Are you sure about that? Not every, when it go to the brain.
No. Oh, it can.
Yes or no?
I'm not sure.
You're not sure.
No.
Okay. The first answer was correct. It can go to the lung. It's called pulmonary what? Embolism. Why? Because the stationary clot called thrombus is converted into what? A traveling clot called an embolus. The moment you exercise that leg, you will dislodge and it will break off from the wall. It's attached to the wall. It breaks off. It becomes a traveling clot. It travels from the leg vein to the femoral vein, then of course into the inferior vena cava. Then from the inferior vena cava it goes where? The right side of the heart, the right atrium, the right. Now why did it not stop in the right, excuse me, inferior vena cava? It's like the 5 freeway, right? 5 North, Union Station. Why? Because the vena cava is big or large? Large or big? Big. Did it stop in the right atrium and the right ventricle? Why? Because these are big chambers. Did it stop in the pulmonary trunk? No, it's a big trunk. But will it stop in the pulmonary capillaries of the lung?
Oh, yeah.
Do you know that a capillary can only allow the passage of what? One red blood cell. So is the clot bigger than the red blood cell? In other words, the clot will be filtered and it will definitely stop where? In the lung. Can it go beyond the lung? Never. Right? Never. In other words, a clot coming from the leg veins will get to stop in the lung. It's called pulmonary embolism. What about a clot in the right side of the heart? Can it go to the brain?
Yes.
Yes or no?
No. No.
I just told you the answer. A clot that is formed in the leg vein will stop in the lung. A clot formed in the right side of the heart will also stop where? In the lung. Now the big question is this: when is it possible that you can form a clot in the right side of the heart? Yes? Yes, my dear?
Wait, can you say that again?
When do you form a clot in the chambers of the heart? Although this will be the topic for 1 week or next week or 2 weeks from now, but I'll give you an idea. Huh? How can you form a clot, whether right or left? It doesn't matter. If the clot is formed on the right side of the heart, it will stop in the lung. If the clot is formed on the left side of the heart, it goes to the aorta and it goes to the brain. Yeah, it's called cardioembolic strokes. Cardio means it's a source of the clot. Embolic means the clot traveled where? To the brain, passing through where? The 405 North Freeway called the aorta. and the aorta to the common carotid, right? Are you following me? Okay? So, the only possibility that the clot can travel to the brain if the clot was formed in the left atrium and the left ventricle. Now, the question is this. Now, I know it might be too premature to give me the answer, but what do you think will cause a clot to form in the chambers of the heart? Remember, the heart has chambers. It's a space. But there is what? There's blood in them. What do you expect? Yes? Yes?
An arrhythmia?
Very good. Arrhythmia in the form of what?
Huh?
In the form of what? Atrial what?
Fibrillation.
Very good. I'll tell you what. This is too premature. I'll just give you an idea. Remember the heart? When the heart is continuously pumping blood, there is continuous what? Movement of the blood. In other words, continuous flow. Why? Because it's continuously pumping. What happens when you have a fibrillation, or what is a without rhythmia, without rhythm, such as
No few
so that time that it's not pumping blood, can you form a clot? Can you form the clot during the time when you have a skip beat? Yes, you can. So it can form a clot. Now, what happens if you go into a ventricular fib? It's different. What is this? It's a flat line. The flat line indicates that there is no electrical activity. Before the muscles contract, there has to be electrical stimulation coming from the pacemakers of the heart. Remember the SA node, the AV node, the bundle of it, the Purkinje fibers? Those are the ones that will stimulate the muscles to contract. In other words, if the pacemakers are destroyed, then you have an arrhythmia. And when you have an arrhythmia, the most common is atrial fibrillation. If it affects the right side, you have a clot that goes to the lung. If it affects the left side, the clot travels where? And that's what we call cardioembolic stroke. Are you following me? For those who are part of what we call silent majority, ask your questions now because there's no other time. Do you understand what I'm trying to show here? The importance of knowing the anatomy of the right side of the heart and what are the blood vessels that brings blood there, and the anatomy of the left side of the heart. What's the blood coming from here and going out via the aorta? The blood going to the left atrium is the pulmonary veins from the lung. Does that make sense? Okay? The other point, therefore, I have to make is this. When we're dealing with these kinds of problems, are we going to solve the problem of atrial fibrillation? Now, what caused the problem in atrial fibrillation? What do you think? Remember the SA node is there, the AV node, the bundle of this. Very simple. What could damage the pacemakers of the heart? When you have what? Coronary artery disease. Remember, these pacemakers have what? They're made of cells, tissues, right? In other words, if they do not have enough blood flow from the right coronary, will that affect the pacemakers here? Left coronary will affect the bundle of the Purkinje fibers. Definitely. There's a reason why the pacemakers of the heart, they malfunction because the absence or inadequate what? Blood flow of oxygen. Do you understand? And of course we have to give anti-arrhythmic medications. Is that clear, class? Okay? Or if necessary, we give what? A pacemaker. You have heard of the word pacemaker? So we're lucky every time we dissect a cadaver, some of these pacemakers are implanted here. We're getting, what the heck is that? And they ask, what is this, Dr. Gamo? That is a pacemaker created by J. Gamo Industries. I'm just joking, there is none. Okay. It's a pacemaker as big as this, okay? In fact, remember what happened here? The patient went into ventricular fibrillation, the heart will some of these pacemakers now have a built-in one. What do we do when you go into cardiac arrest? We defibrillate, right? Defibrillation is done, right? We have an AED. You know what an AED is?
Automated external defibrillator.
Automated external defibrillator. It's not automatic. Tonight, during the break, go to the area there. It's wrongly spelled. It's automatic. Is it automatic or automated? Go there. Confirm. Take a picture and show it to me. Your cell phone. It's so embarrassing. We're supposed to be a University of Nursing students, and here you are. I hate the wrongly spelled word, automatic. It should be automated. So this AAD, and in the hospital we use a bigger defibrillator. Stand clear, I'm clear, everybody clear. You save a life. On the other hand, stand clear, I'm clear, everybody clear. Stand clear, I'm clear, everybody clear. Stand clear, everybody clear. Time of death, 7:04 p.m., November 13, 2018, West Coast University Medical Center. Signed by the physician and the attending nurse, okay? Now, going back to this, therefore, do you understand the importance? Now, what's the difference between deep vein thrombosis and thrombophlebitis? Which one involves the deep veins? Don't you love this class? It's so simple. What is deep vein thrombosis? What is involved? The deep veins. And what happened in the deep vein? There is what? A stationary what? Clot that formed in the wall, attached to the wall of the tunica intima of the veins in the leg. What about thrombophlebitis? They usually affect what? Superficial veins, but can they also affect the deep vein? Yes, they can, right? Now, in the case of thrombophlebitis, it's very commonly seen in the nursing home. Because why? They complain, and they've been there. They've been your patient for some time, okay? The only way to prevent is by making them walk, exercise, dance, or use the walker. But whether you like it or not, it could develop, even though how much you tell them to exercise or walk. So watch out, do not exercise the moment it's diagnosed, okay? Now, deep vein thrombosis, on the other hand, is different. Clinical scenario. It usually develops when you travel for a long distance by plane, like me. Last year I went home to the Philippines for my 40th high school reunion. How long will it travel on top of the Pacific Ocean? 15 hours, right? Right? So, while going through the Pacific Ocean, what did I do? My wife and I, we what? We danced. No, I'm just kidding. Okay, I walk around looking for pretty women. Okay. I'm just joking, of course. Honey, I love you, so I walk around the plane. Even though I did not have the desire to make pee-wee, I pretended I have the desire to make pee-wee. Pee-wee, pee-wee. I go to the back of the plane, pretending to go and then forming a line, you know, and after I go back to my seat and go to the front looking at the what do you call that, the business class. They're so rich and I am so poor. What they can do, which I cannot do. Okay? And then one time there was this patient who had a seizure. Should I help? Or I'm not licensed, so I might as well not just watch. This is true. I think there was a nurse there, so like, okay, go ahead. It's really sad. There was a person with a seizure, but if nobody would attempt to help, I would have probably attempted, but you know, somebody was there. I am a nurse, okay. I am a doctor, but not licensed in the US. I teach at UCLA, but what will they do? You know, if something happens to the patient, I'll be in deep stool. But worst case scenario, I would have well helped, but you know, and this is true. The patient has a seizure. Ooh, okay. Generalized tonic. I was diagnosing the patient while she's having the seizure. She has what we call a generalized tonic-clonic seizure. Okay, and then of course. Anyway, the reason why I'm saying this is because when you travel for 15 hours, what do most people do? They sit down on the chair for 15 hours. Is that good?
No.
Very bad. Because there is a possibility that you form a clot in your deep veins. And is there a possibility that you'll die of pulmonary embolism? Yes. So this is a usual scenario. You have the deep vein thrombosis. You don't even know that you have a deep vein thrombosis. You go to the carousel where you get your luggage. And while waiting for your luggage, all of a sudden you just suddenly feel chest pain with onset of severe difficulty of breathing, which is called SOB, or shortness of breath. Yes.
How much does that occur though?
Incidence-wise, I do not have the statistical data right now, but maybe, I don't know the data, maybe 2-3%. It's very small, but still it could happen to you. If you are the lucky one, I'll see you in heaven. Okay. 20 years from now, I'll be dead, but you'll be ahead of me. Go ahead. I don't mind.
I'll wait for you.
You wait for me? Perfect, perfect.
I have a house by then.
We'll be together, okay? Together again.
I'll make dinner.
Okay, in heaven? I don't even know how they serve food there, right? Okay. Can you imagine? If only I can text from heaven and said, hey, here I am. I developed DVT. I'm just curious, if only we can communicate.
Are you going to teach there too?
Of course, I'm going to teach anatomy there. Yeah, okay, I'll teach the disciples. When you were doing the Last Supper, you could have developed DVT if you stood for 15 hours. I'm not kidding, I will teach them that. Remember the 12 disciples in the Last Supper, they were standing for 15 hours, waiting for, on the night he was betrayed. And they're all standing for 15 hours. Hey, you know what? You should walk around Jesus, you know. But so it's true. I would give him the same advice because I am concerned about their safety. You know? That is true. Okay, I'll be in trouble now. Okay, let's not talk about religion in class now. Okay, now. So we talked about phlebitis. Now, this is one of the common. So varicose vein, phlebitis, and all these things can happen, right? And of course, the thing about varicose vein is that the only way to treat them is what? You know? Huh?
Laser therapy.
The sclerotherapy, where you actually inject a what? A sclerosing agent to stop the flow of blood. If there's no more blood flow, there is no more vein, there is no more varicose veins. You know what's a sclerosing agent? It's an agent that you put into the vein to stop the flow of blood. And if you stop the flow of blood, there's no more vein. Now you might be, what the heck, Dr. Gama, what happens now? There's so many leg veins, even if you stop the, in fact, we call it venous stripping, you know, not stripping when you become naked. You know? Stripping, S-T-R-I-P-P-I-N-G, to strip means to remove the veins, surgically, okay? And like my wife underwent that procedure. She has varicose veins. It's the fault of my kids because when my wife was pregnant with my kids, guess what did the baby do to the vena cava? Have you ever seen this pregnant when it's so big, baby? So I blame my kids. See what you did to your mom? You caused her to have, she used to have very nice leg veins. You know? Now because of your size, you compress the vena cava of your mother, inferior vena cava, and therefore it compressed the blood flow, and therefore the blood in the leg vein did not go up to the right atrium of the heart. Guess what happened? The valves were destroyed. That's why your mom has varicose veins. So she went to this very good-looking doctor who looks like Brad Pitt at Cedar Sinai. She forgot about me, okay? I said, yes, she's very, I had a crush with the doctor also. And she's very good-looking. I'm just kidding, of course. So they removed her leg vein, so she now has nice legs, okay? Yes?
Are varicose veins hereditary?
What?
It
could also be hereditary, like if you're, this is what I tell my kids. I say, if you want to marry somebody, a woman, look at the mother. I'm not kidding. Look at I have a crush on you. I'm going to date you, right? But before I date you, I plan to propose marriage to you, let's say a couple of years, but I look at the mother first. If the mother has varicose veins, I will 100% you will have varicose veins. I will not marry you. No, I'm just joking. I can have it removed, right? The leg vein, so I will still marry you because it's love. Has nothing to do with the varicose veins, right? But I'm not kidding. It could be, right? And it's true because genetic. You cannot choose your mother and father. So veins or varicose veins are most commonly, unfortunately, among women than men. And one of the predisposing factors is becoming pregnant. But please do not stop getting pregnant. Oh my God, I don't want to have varicose veins, Dr. Gama. I don't want to be pregnant. Or you can rent a uterus. Are you aware of that? Yeah. I'm a businessman. You can give me, I will give you a surrogate mother. For $30,000, $5,000 goes to me, $25,000 goes to the mother. Yes?
Can the varicose veins go away on its own?
I doubt it, because the problem is a permanent damage to the valves.
Blood flow?
So it will never cure by itself. The only way is to have it surgically removed, or sclerotherapy, or laser. They have this endo laser treatment. So I did a lot of research for my wife because. Are you not going to help me? I said, because there's a lot of pain there. There's a lot of, and they have these stockings that they have, compression stockings for varicose veins. And she was complaining because, are you not a doctor? I'm not licensed. When they don't like me, they went, you're not licensed here, Dad. And my wife was, but when they need something from me, you're a doctor. I said, yeah, but you keep on saying that. Okay, now, anybody, so, now let's move on to to blood flow. We talk about blood flow. Now, oxygen transport, right? Okay, what about oxygen transport? The most important cell is what? The red blood cell. Why? Because it's the one that transports oxygen, right? You know that the red blood cell or erythrocyte has 2 alpha and 2 beta chains, right? The hemoglobin, right? Chains. Globin means protein. Remember the word protein? Globulin, plasma globulin, globulin. 2 alpha and 2 beta chains. And in the middle of these chains are what we call the porphyrin ring, right? And inside the porphyrin ring is where you find the oxygen. In other words, a hemoglobin molecule can carry as much as 4 oxygen, right? Because of the 2 alpha plus 2 beta, 4 total, right? Okay. In order to produce the red blood cell, do we need iron? Of course. Iron, okay. In order to produce red blood cell, do we need vitamin B12?
Yes.
Yes, we do, right? B12. Now we know that the red blood cell, they're produced where? Where do you produce the red blood cell? Yes? Of course. Which one? Red or yellow?
Red.
How can you forget red blood cell, red bone marrow? Why? What is found in the yellow bone marrow? Fat. What is the color of fat? Yellow. Like your sweatshirt, yellow. If I die today, if you dissect my cadaver, it will all be what? Yellow. I'm just excited. If you dissect me, you'll see. I will be a ghost at your back. See, I told you, it's yellow. Okay. Now, so when we look at this red blood cell formed in the red bone marrow, the lifespan of a red blood cell is how many days? 120 days. That's almost 4 months. 4 times 30 days is 120 days. They are producing the red bone marrow. But where is the forest lawn cemetery of these red blood cells? Where do they die?
Spleen.
Huh? Of course, the spleen. And that's what I tell my former students in anatomy. They are formed in the red bone marrow, the birthplace. And where is the cemetery?
Spleen.
The forest lawn spleen cemetery, right? So how did they get to the spleen? Very simple, to the blood circulation. What is the blood vessel that brings blood to the spleen? Splenic vein. What is the blood vessel? Splenic artery. What is the blood vessel that brings blood away from the spleen? Splenic vein. So how do these red blood cells go to the spleen? The splenic artery. From here, see? Abdominal aorta. What is the name of the artery to the spleen? Splenic artery. Don't you love anatomy? What is the name of the artery to the liver? Hepatic artery, because hepatic means liver, right? Okay, now. So when the red blood cell, I had a chance to talk to these red blood cells before they die, okay? So one of them said to me, Dr. Gamo, I'm tired. I'm now 119 days old. In 24 hours, I will rest in peace. I'm looking forward to my plot at the spleen. So I'm about to go. So it goes like this. Where is the spleen? Oh my God, it's in the left upper quadrant. Okay, finally, she reaches the spleen. Okay, the spleen, red blood cell dies. Now the question is this. Why, of all places, why the spleen? What will happen in the spleen? And I spoke to these people and they told me the answer. I don't know if they told you the answer too. What did the red blood cell tell you? Huh?
They get renewed.
They will be what?
They get
Recycled. That's a secret they told me. Dr. Gamo, we red blood cells, when we die in the spleen, recycling, and it's good for you. What will be recycled? The iron, of course. And if I die, I donate my iron. They are involved in organ donor transplant. The red blood cells. See how useful I am. Not only will I carry the oxygen when I'm alive, not only will I carry the carbon dioxide when I'm alive, but upon my death, I will still be useful because you can recycle my iron supplies. And where will we bring the iron? Back to where? The red bone marrow. Don't you love anatomy? From the spleen, splenic vein, and then all the veins goes into what? The blood circulation towards the red bone marrow in the bone. Do you understand? Okay? The bottom line, therefore, the red blood cell will be recycled, used to manufacture future generations of newer erythrocytes. Now, as you also know in anatomy and physiology, when the red cell dies, matures, it loses its what? What has happened? It loses what? The organelles, right? Remember, in the cytoplasm, you have what? Cytoplasmic what? Organelles, right? Mitochondria, endoplasmic reticulum are gone. In other words, for the red blood cell to survive, it will rely solely on what? Food substance. Who said? Who said glucose? You're the woman. I'm going to hire you already, okay? Glucose, of course. Glucose is the only food substance they can subsist on. So they don't complain. Unlike many of us, oh, I want fat, I want liver, I want pork, I want chicken. Red blood cells, they're so chill, you know. I just need glucose, I'm okay. Isn't it amazing? And we take our red blood cells for granted. Have you ever spoken to them and thanked them? I'm joking. Dr. Gamo is getting crazy. So the red blood cell will subsist on glucose. Does that make sense? And it's really amazing what they can do for you. When they die, they basically what? Be recycled, right? Recycle, okay? Do you understand? Now, in the manufacture of red blood cell, I told you the importance of what? Iron, right? So what is the most common form of anemia? Exactly, especially women who become pregnant. How many of you have been pregnant? Have you had kids already, right? I suppose. When you were pregnant, were you given iron supplements in the form of ferrous sulfate, right? Why? Because you are competing with your baby. Have you ever told your baby, honey, when you were I was pregnant with you, you were competing with my iron, but I love you, I have to sacrifice my iron stores. The doctor had to give me ferrous sulfate. Now, what did the doctor tell you? That when given ferrous sulfate, from the word ferric, what is the chemical symbol of iron? Fe. Fe, that's why it's called ferrous sulfate. FeSO4 in chemistry is ferrous sulfate, right? Okay. I love chemistry. Now, okay, did the doctor tell you anything? When I start you on ferrous sulfate, what are you going to WOF? What is WOF? Watch out for. Sometimes I put that on the chart for the nurses. WOF. Watch out for. Like LOL. Laugh out loud. Yes, do you remember? Okay, what about you? Who else has been pregnant and had kids with given ferrous sulfate? Anyone? Yes? What will happen to you? What will the doctor tell you if you're given ferrous sulfate? You had kids, so kids? What did the doctor tell you? The color of the... She's the woman. You're not LVS, right? Okay, but still, the doctor should have told you. What happens to the color of your stool when you take ferrous sulfate, my dear? What's your name?
Emma.
Emma, what happens to your stool color? What is the name of the color stool? What's its color stool? It's black. What's the color of the stool? Black when you're given what? This drug, right? When a patient... Now, this is a very important question. What's the name of the gentleman to your front? Josh! What is the normal color of our stool? Not your stool, but our stool, Josh. What? Brown. Golden, yellow, brown. Gold, yellow, brown. Every time I look at the stool, I think of gold. Money. Money for the nursing caregivers. Manual extraction, $20. I used to joke about that. When I was new here, I have a lot of friends who were caregivers. Okay? And a lot of these my friends, the friends of mine who are caregivers, they always complain to me. When the patient is constipated and has fecal impaction, what do we do? Aside from giving laxative and all this, manual extraction. Anyway, what's the color again, Josh? Golden, yellow, brown. So therefore, Josh, when it becomes black, is that normal, Josh? Normal or not? Huh? On this drug? It's expected, right? But what is the normal color, golden, yellow, brown? What happens if it becomes black? Is that abnormal?
Yes.
Abnormal if you're not given this drug. So it means there is bleeding where? Stomach ulcer bleeding. The blood travels through the small, 20 feet long intestine and, and the 5 feet long large intestine. By the time it reaches the stool, it becomes black. So you mentioned the word. What was the word that you described? It's called what? Melina mandikova. I'm just kidding. Melina is like a Russian name, right? Melina. Anybody who's Russian here? Who's Russian here? Are you Russian? I'm also half Russian, okay? I'm just kidding. A lot of Russians have my nice, beautiful eyes, right? So, in the area near in the China bordering Russia, right? Okay, now, does any Russian name that means Melina? Huh?
I'm sorry?
Is there a Russian word that means Melina? Melina word? No? No, probably not. I'm just joking, of course not. There isn't.
Malina. Yeah, it's
Malina is a name, right? What does Malina mean?
It's also a fruit.
Oh, a fruit.
Cherry.
Oh.
Yeah.
But this one is not the fruit. This is the color of your poo-poo.
It's a raspberry.
You don't want to eat this poo-poo. Oh my God. Tastes like poo-poo, smells like poo-poo. Okay. When your patient has melena, it only means one thing, right? There's bleeding in stomach ulcer, right? Okay? Or esophageal varices. Now, what happens if the stool is cherry red? Is it what? Fresh blood or fresh blood? We call it hematochezia. Okay? This black tar. What is tar? The road, asphalt. You know, black stools, tarry night. Black tarry stool. From the word tar, T-A-R, asphalt. Right? The pit tars in what do you call the place there? Tar pits, yes. Now, hematochezia, the color of the stool has cherry red. Cherry red, which means what? Fresh blood, usually found in lower GI bleeding. Lower GI means anything below the duodenum, jejunum, ileum, and large intestine. Like when you have what?
Hemorrhoid?
Exactum. What's that hemorrhoids? When you have hemorrhoids and you put the tissue paper, oh shit, what's in blood? Oh my God. You're laughing. You would end up with bleeding hemorrhage. You laugh at yourself. Oh my God, Dr. Gama was right. Cherry red. When you have hemorrhoid, because what are hemorrhoids? Hemorrhoids are just dilated what? Hemorrhoidal veins. It's very common when you become pregnant again. This pregnancy thing, you know, don't get pregnant. Get pregnant. We have to have more people in this world, right? The pregnant uterus is compressing the vena cava, so you end up with hemorrhoids. Or you can have hemorrhoids when you have liver cirrhosis, and you will talk about that later on, okay? Do you understand? Now, red blood cells, therefore, it's also important that you have vitamin B what? B12. But in order to absorb the B12 here, in the small intestine, what is the chemical substance that is necessary to the absorption of the vitamin B12? Wow, I can see this group of people studying for the quiz. And where is the intrinsic factor produced to be able to absorb vitamin B12? What? The parietal cells of the stomach wall, exactamente. How can you know all these things? You took down notes?
Yeah, from your teach back.
Huh?
From your teach back.
I said this in the teach back?
Yeah.
Why did I say it in the teach back? I should have said that because I'm going to ask it in the quiz. I'm just kidding. Really?
Yeah.
How many teach backs did you see on these chapters? Huh? I think there were 2 or 3, right? So you watch all those teach backs? Did you subscribe to my, you only what?
Well, I think
I suggest you watch 2 because sometimes, because of time limitation and sometimes it stops at the middle of the teach back.
okay.
So if there are 2 or 3 teach backs on these chapters 10, 11, 13, 14, 15, then you might as well watch, okay? And she's absolutely right. Vitamin B12, right? In order to absorb B12 in the small intestine, you need intrinsic factor produced by the parietal cell in the wall of the stomach. And therefore, the lack of intrinsic factor and the lack of absorption of B12 can lead to what kind of anemia? Pernicious. In other words, the most common is iron deficiency anemia. The lack of intrinsic factor and absorption of B12 is called what? Pernicious anemia, which is a form of megaloblastic anemia. Do you understand? Okay? And obviously, you have to give what? Basically, you have to give what? In the case of iron deficiency anemia, ferrous sulfate. Does that make sense? Okay? Now, so that's a kind of anemia. And of course, polycythemia is the opposite, wherein you have what? Basically, increased red blood cell count, right? Okay? Now, what is the difference between that and aplastic anemia? Does anybody know what is aplastic anemia? Yes, the lady to your front. Josh, what is your name in there? Yes, you, of course. Huh?
Haley?
Haley? What is aplastic anemia, Haley?
I just blinked out.
Take your time, chill, relax. Okay, the person in front of you might want to help you. What is aplastic anemia? What is the characteristic feature of aplastic anemia? Yes? Anybody? Yes? Yes?
Pancytopenia.
I think you're planning to get the perfect score in this quiz, huh? I think I have to change my questions. I can tell you, some people will get a perfect score. Okay, what is pancytopenia?
It's when
Okay, I'm just kidding. I'm just keeping myself awake. Yes, what is... The young lady answered me, in aplastic anemia, there is pancytopenia. And how would you define pancytopenia?
it's when the red blood cell, white blood cell, and the platelet counts are all low.
Why? There must be a reason. Remember, how do you become smart? You always ask yourself why, where, what, and how. So in this case, why and where is the pathology in this patient with aplastic anemia? What part of the body is affected in aplastic anemia? Why the red bone marrow? Because what does the red bone marrow produce? Red blood cell, white blood cell, platelet. If the bone marrow is destroyed, your red blood cell count goes down. It's called anemia. Your white blood cell goes down, it's called leukopenia, below the normal range, right? Between 5,000 to 10,000. Anything below 5,000 is leukopenia. And of course, when there is a drop in your platelets, it's called thrombocytopenia. Now, what is a common cause of aplastic anemia, my dear? So it's not just knowing what it is, the definition, but what is the thing that causes it? So that, remember the primary prevention we talked about? Yes? Of course. There was a time when I was in high school and a medical student at that, we used to work in the garden as part of our training as high school students. We would make the plot, we plant vegetables there and everything. And then we were using what? Some of these chemicals like insecticide, like malathion, not realizing that they can cause what? Toxic effect on the bone marrow. So be very careful in the chemicals that you use. I'm not saying all the chemicals are harmful, but in the 70s and 80s, there were not much of regulation all over the world. All they needed was money. They want money. They sell everything, even though it will cause the death of people. So certain chemicals designed to kill pesticides, insecticides in the garden were related to the development of aplastic anemia. And of course, you have to diagnose by doing a bone marrow aspirate and do a bone marrow biopsy. Does it make sense, right? Okay. Is that, oh shit, what the hell was that? Sorry, did I say shit? It was so strong, it was like a bomb, right? A missile. And it looked like a missile. Look, can you raise it? It's like a, it's a bomb. Oh, it's a missile. I don't want to die yet. My youngest will graduate in December. Yes, after that I can die. Okay, but not before December. I have 1 month and 2 weeks to go. And besides, I still have to give your final exam, right? So, okay, now, so in anemia, aplastic anemia, it's very difficult. The only way you can help them is doing a bone marrow transplant, right? Bone marrow transplant. Now, okay, let's talk about malignancy of the white blood cell. Let's start with hypersensitivity, right? In the hypersensitivity, some of you, it's better to do a table, right? So what are the tables that you can create? Type 1. Type 1, 2, 3, and what?
4.
Okay, right? Okay. And apparently, one way of, how many of you have a whiteboard at home? I strongly suggest you do what I'm doing here. Like if you do this 10 times a day, how can you forget, right? You translate your notes into your brain, right? Okay, without looking at your notes, okay? Like the formula I wrote here, pretend that you are the teacher and you're teaching your what? Your dog or cat. Not your 5-year-old kid because it will roam and, Mommy, I want some milk. Okay, don't distract, okay? Now, yes?
Can we take a quick break and then come back?
Unfortunately, I have to give the quiz after this, so
Okay.
I can't take the break. You understand? Okay. So 1. Unfortunately, I cannot give the break. 2. And besides, 3. And then what? 4. Okay? Okay. Type 1. What's another name for type 1? Immediate, right? Hypersensitivity. So these are hypersensitivity, right? There's no more ink. Let's just do it this fast so that you can take your break. I know you're excited to take your wee-wee break and the poo-poo break, okay? But if you have to leave, go ahead, okay? Anyway, this is in the video, okay? Type 1, immediate hypersensitivity. Effect will be within 15 to 30 minutes, very fast, right? It's usually seen where? What are the cells involved here? Huh? What? What cell? Okay, B cell. What do B cells produce? So all of these are what? 1, 2, and 3, they're all what? B cell. What about 4? So that's one way of what? Summarizing things. Type 1, type 2, type 3 involve the B cells. And what do B cells produce? B cell produce what? Antibodies by becoming what? They become plasma cell. And the plasma cell is the one that produces what? The antibodies. In the case of type 1 here, what's the antibody involved? Which we'll learn again in anatomy and physiology, IgE. And what will be the effector cell? It affects what cell? The mast. Right? So the IgE will involve the mast cells, and what does the mast cell release? Histamine. Okay, what is the effect of histamine on the body? It causes vaso what? Dilation or constriction? Huh? Okay, constriction or dilation? Okay, what else? You said double check. You said dilation or constriction? Can somebody check the book? Can somebody check?
Dilation.
That's why I said dilation. Why? Because it causes increased blood flow, right? But it can cause what? Broncho what? Constriction. But vasodilation is the reason why when you vasodilate, you increase what? The blood flow. That's why when you have an allergy, there is what? Is it true? Is it? Can we double check? Is it vasodilation, right? In the book? Okay. Histamine causes vasodilation. That's why you have increased blood flow. That's why when you have an allergy, it becomes red because there is increased blood flow, right? Okay. So basically, this is what? Atopic dermatitis, allergic rhinitis. Yeah. When you're exposed to the pollen, you have an allergy, IgE, mast cells, histamine. So what kind of drug do we give? Antihistaminic drug. Isn't that amazing? If you know what is the cause, you know the treatment. What do we give? Antihistamine drugs, right? Amazing, right? Pharmacology. So atopic dermatitis, allergy, asthma, and everything, right? What about type 2? What's another name for this? Huh? Tissue specific and cyto what? Toxic, cytolytic drug type of hypersensitivity. What was the example given here? Can anybody tell me? Graves' disease, what else? Myasthenia gravis or gravis, right? Okay. And then what else? You have what? Hemolytic disease of the newborn. What's another name for hemolytic disease of the newborn? Huh? Erythroblastosis what? Fetalis. Now why is this disease process dangerous? Oh, I forgot. What about blood transfusion, right? Right? Blood transfusion? Why? What happens in blood transfusion?
Wrong blood type.
Yes?
So it's only, you said it's only serious during second pregnancy?
No, I'm talking about blood transfusion first, before the hemolytic disease. In blood transfusion, let's say I am blood type B. Who can give blood to me as blood type B? Only B and O. Why? Because I have B, what do I have in my plasma? Anti-A. I hate all the A's. If you're type A, don't give your blood to me. Why? Because if you have A in your blood, on the surface of the red blood cell, the moment it goes to my blood, what will my antibodies do?
Attack
Attack the red blood cell that was given to me. So who suffers? Me. Why? Because I was giving the wrong blood. But the red blood cell that was given to me who has A antigen, if this is the red blood cell, A antigen, I have anti-A antibodies. What is lysis? Burst. It will attack. Enemy, it will attack, right? So this will occur in my own blood, but I will suffer because I was given the wrong blood, because I should not have been given type A because I am type B, right? The only blood that I need is B or an O, which is the universal one. And what is the universal recipient?
AB.
AB. Now, what about hemolytic disease of the newborn? Very simple, in a nutshell, so that we can have a break in a short time. A mother is, what is RH? RH stands for rhesus what? Monkey. Another name for this is RH antigen or what? D, as in dog antigen, right? In your red blood cell, therefore, not only do you have the A antigen and the B antigen, but the red blood cell has the A or the B antigen on the surface of the red blood cell, or what? RH. It's not the letter RH, but it's something that is an antigen on the surface, right? So, example, like me, I am type B positive. The word positive means I am RH positive. Anybody here who is RH positive? Anybody here who is RH negative? Okay. If you are RH negative and you are a woman, you better pay attention to my discussion. This hemolytic disease of the newborn, or erythroblastosis fetalis, only happens in women who are what? Negative mother, and of course the mother is a woman. So if you raise your hand and if you are RH negative, pay attention. Your husband or your partner in sex is positive. I was about to say partner in crime. Is positive. This is your husband. So husband is positive, the mother is negative, they have sex, mother gets pregnant, the first baby is what? RH positive. Why? Because it got the genes of the father. Father is positive, the baby is positive. Is there a problem? There is a big problem. Why? Mother is negative for the antigen, but the father and the son and the baby has positive antigen, right? Okay, now what happens? During labor, remember? 9th month of pregnancy, during labor, remember? There is placental separation. But who comes out first? Baby. Remember? Did I show this in class? So when the baby is here in the vagina, and he goes like this, vagina here, push, push. Oh, thank God, I came out first. Thank you, mommy. Now, why did the baby thank the mommy? Because when the baby came out, the first baby has no problem. Why? Because when the baby comes out, what comes next? Placental separation, the placenta follows. And this will come out in the nursing board exam in the form of what? Lengthening of the umbilical cord and a sudden gush of warm blood. That will tell us that there is what? Separation of the placenta, which was providing blood to the baby. Now, The problem now is that when there is placental separation, what happens to the uterine arteries? They become open, right? So during placental separation, in a mother who is Rh negative and the father is Rh positive, the baby is Rh positive, the first baby is safe. Why? Because when the baby comes out, the placenta will follow. That means the baby is safe. But the moment there is placental separation, is it possible for the blood of the mother and the blood of the baby to mix?
Yes.
Definitely, okay? So if there is mixing of the blood, what will happen? Like Star Wars, enemy, interceptors immediate launch. The mother will develop what? Antibodies against the Rh antigen, and it will not be found in the blood circulation. But the good news is that the first baby is safe because the baby came out. That's the reason why the baby was thanking the mother. Mommy, thank you, thank you. I'm not kidding. These babies like to thank the mother, you know, even though they crush their heads, you know. Imagine the baby being crushed. Shit, Mom. So right. But it's okay. And maybe come out first. Right? So, why? Did it not happen to you? It did not happen to me, thank God, because I was by cesarean section. I remember the first time I was doing this, I kept on telling my student, I had the same experience, and my aunt, who was a physician in Philadelphia, said, you did that to your student? You told them that you were born by C-section? Yes. I was the one who delivered. I did C-section. Really? I look at my birth. Oh, yeah, you're right. You're the. Her name was Chofila Sarabia. In my birth certificate, her name is there. And she's, oh shit, I was lying to my student. I kept on telling them that, you know. That's what I learned from my aunt. So anyway, so there is now antibodies produced in the first pregnancy. Again, mother and father have sex. Mother gets pregnant. Second baby, there is a problem. Houston, we have a problem. Why? Again, if the baby is Rh positive, oh my God. Is there going to be a problem? Yes, why? In the second pregnancy, you can never guarantee that the placenta will filter the blood. So during the 8th month of pregnancy, is it possible for the blood of the mother with antibodies against Rh to infiltrate the blood of the baby? So what happens is that, what is hemolytic disease? Hemolysis. The antibodies formed by the mother will destroy and damage the red blood. They will burst. Hemolysis means bursting and rupture of the red blood cells in the body of the baby. The baby could die, right? It's called, also known as erythroblastosis fetalis. Is it going to be fatal? Yes, it could. Okay. So, what is the moral lesson from this environment or situation? How many of you here do not know your blood type? Very good. So if you don't know your blood type, most likely you don't know whether you're Rh positive or not, right? Okay. But some of you raise your hand when I say you are Rh negative. At least you were honest to tell us that you're Rh negative. So, I'll tell you a story.